Welcome, everyone. Thanks for joining us. It's always fun to see that number climb when we hit start webinar, so we'll give that a second for everyone to get in. And we can start sharing the screen.
Okay.
I'll get us started. Okay, our number is still climbing, but I'm going to go ahead and start so that we can use all the time we have today. Thanks for joining us today for our November Strengthening Families webinar. Today we're focusing on economic stability and family well-being. I'm Kaylin O'Connor from the Center for the Study of Social Policy. I am welcoming you and introducing our guests today. So let's go to the next slide. Just a quick run through of what these webinars are all about. If you don't usually attend, this is a monthly webinar that we open up to anyone who's interested. If you're using the Protective Factors Framework, coordinating strengthening families efforts, wherever that may be, you are welcome to join these webinars when the topic is interesting to you. We convene these jointly between my organization, CSSP, and the Children's Trust Fund Alliance, represented today by Maureen Holliker. And each month we have different topics, usually guest speakers, sometimes discussion. We try to mix it up. And the recordings and materials are always posted at the website you see there. I will put that in the chat box in a moment. And let's go to the next slide for a little more about what's coming up in this series. Oh, whoops. Okay, I'll put the registration link for next month in the chat as well. But we do these on the second Thursday of each month, 3 o'clock Eastern. It says usually there because last month it was on a different day, but we really generally stick to that second Thursday of the month. So you can put that on your calendar and then see if the topic is of interest. Next month, we will be talking about quality rating systems, quality improvement systems for early care and education, and how strengthening families is represented in those, especially as those systems are evolving. So I will throw that link to register in the chat. And you can make sure that you get our newsletter so that you get the announcements when these webinars open up for registration. But like I said, you can mark that second Thursday of the month on your calendar and join us when the topic is interesting to you. All right, I'm really excited to welcome our guest today. We can go to the next slide to talk about economic stability and family well-being. Clare Anderson and Yasmin Grewal-Kök are from Chapin Hall at the University of Chicago. Clare is a former CSSP staff member and longtime partner, and Yasmin has been doing this work along with her at Chapin Hall and with some of our colleagues at CSSP, where they have been, everybody's digging into this research about concrete support and family economic stability and how that affects well-being and how that does function preventatively and as a protective factor. So really excited for them to shed this research light on what we have talked about for so long about concrete support in times of need. After their presentation, we will have our usual updates, but I won't hold us up any longer from getting to the main event. Welcome, Clare and Yasmin.
Fantastic. Thank you so much. We are so happy to be here. We're going to spend a little bit of time talking about economic and concrete supports as a core component of a child and family well-being system, as family well-being, and as Kaylin was describing, really a primary and secondary and tertiary prevention strategies for reducing family involvement with child welfare. So I'm going to start out just by talking a little bit about the intersection of family economic insecurity, income, and child welfare. But as Kaylin just noted, the best place to start is that Strengthening Families has known from the very beginning that concrete support in times of need is critical to ensuring that families are strong, that they have the protective factors necessary to be strong so that children can thrive, and that family involvement with child welfare systems go down. We hope to really bring you today a fair amount of evidence in support of this protective factor and a set of policy options, or tying the evidence to policy options so that we all begin to have a much more nuanced understanding of the kinds of policies that we should be concerning ourselves with and being involved with. So why don't we just get started sort of diving into the data around involvement with child welfare, because it's important what we're trying to avoid, what we're trying to put a concrete support in time of need to prevent. We know that about 60% of substantiated CPS responses across the country and over time involve neglect only. But we also know that neglect is very complicated, inclusive of neglect, because the administrative data across the country is hard to parse apart. We know that substance abuse, mental health challenges, other very complex needs in lives of families are included in what is an umbrella term of neglect. I raise that because it's important to note as we go through the evidence today that we see that economic and concrete supports seem to be having an effect on neglect, irrespective of what is inside this box of neglect. We certainly need to know more, but it's important to see across a long-standing, varied evidence base, a reduction in neglect. But you'll also see that the provision of economic and concrete supports is associated with a decreased risk for both neglect and physical abuse. So it is important to note that in part because I think sometimes we hear, well, poverty is not neglect. Well, it's definitely not. It's far more nuanced, and it is important to begin to try and understand it in a holistic way. Okay, so we're going to toggle here to policy options. So we'll toggle back and forth between data and evidence and state policies. We're starting to see states across the country tighten their legal standards for removal of children from their families and citing poverty at the community level or the family level, including inadequate housing, mental illness, or substance use, as things that need to be ameliorated or taken into account before children can be removed from home. We see that in Washington State. In Kentucky, we see an added component saying that families need to be financially able to meet the needs of their children or be offered financial or other means to do so to ameliorate risk. And in Montana, a proposal for a child protection reform included expanding what we understand to be reasonable efforts required to prevent removal, including identifying community resources like housing, financial supports, mental health and substance abuse services, and actively assisting families to access these resources. So I think these are very important new policy changes that we're seeing at the state level. And we'll talk a little bit about some of the other policies that are more upstream, including expanding public benefits, making them more generous, that I think could and should be paired with this narrowing of the front door of child welfare. We see in Vermont, in its policy framework, an economic diversion system or differential response kind of approach. And often well, let me just talk about Vermont here for a second. They have they've created an economic firewall. It includes interagency collaboration and service coordination, includes family preservation with flexible funds to prevent removals, and a multi-dimensional diversion system whereby families can be referred to economic supports, family resource centers, and a differential response system. We often in child welfare embed a differential response within child welfare, whereby child welfare workers provide the differential response. But imagine this sitting above child welfare, where other systems are accessing this as a firewall to involvement with child welfare. So I think that conceptually there is much to do here to begin to think about both policy and programmatic redesign. And it's important for us to deeply engage in that conceptual and operational work, because we know that child welfare, child protective services is deployed predominantly to families who have low income. Nearly 85% of families investigated by CPS earn below 200% of the federal poverty line. So we are deploying this system predominantly to poor families. When they're and we hope to show evidence of, there are other governmental policies and programs that can and should be deployed earlier in a more expansive way to ensure that this is not the result that we're receiving downstream. So I know I talked a little bit about material hardship and what we're seeing in terms of abuse and neglect. This is a really important study. We see that if low-income families, this was a study of TANF families, experience at least one material hardship, their likelihood of a neglect investigation goes up, but even more so, their likelihood of a physical abuse investigation. And if low-income families experience multiple types of hardship, their times of need, they have a 4 times higher likelihood of a CPS investigation and a 7 times higher likelihood of a physical abuse investigation. Importantly, we are beginning to understand the predictors. What should we be looking for in times of need that are associated with or predictive of involvement with child welfare? On the right, we see food pantry use, cutting meals, housing insecurity, utility shutoff, inability to pay for medical bills for a sick family member as predictive of investigated neglect reports. And the most reliable economic predictors of child welfare involvement include income loss, and we'll talk a lot about negative earning shocks, cumulative material hardship, and housing hardship. So when low-income families who have recently been involved with a CPS investigation and it's been closed, experiencing a negative earnings shock, increase their risk of a subsequent CPS investigation by 18% and of a physical abuse investigation by 26%. But when we offset that, or actually, this is one other important point here. Each additional negative earnings shock is associated with a 15% greater likelihood of CPS involvement. But when we see those shocks being offset, or families are able to access sufficient public benefits when those earning shocks occur, there's a buffering effect against being involved with child welfare. And this is particularly strong, and this is important for you all, for families with young children, because we see a 12% decrease in the risk for CPS involvement and a nearly 50% decrease in risk for a physical abuse investigation. So this concrete support in times of need is actually critically important. We see that during the Great Recession, when unemployment rates were very high, the rate of abusive head trauma for children under the age of 5 was considerably higher than the period before the Great Recession. So in addition to seeing what happens when economic or concrete supports are removed from the lives of families, we're beginning to understand what happens when they are inserted into the lives of families. And this study provides us evidence of a possible causal effect of increases in income on risk for child welfare system involvement. This is a randomized controlled trial in mothers who participated in TANF and were eligible to receive full child support for their children, and that support was disregarded in determining other welfare benefits, were 10% less likely to have a child subject to a screened-in maltreatment report. And even a modest increase in child support payments resulted in a decrease in screened-in maltreatment reports. So I'm going to talk a little bit about context before turning it over to Yasmin. So we know that economic insecurity is pretty widespread, but families move in and out of poverty. Almost 50% of those who become poor are out of poverty a year later, but more than 50% of those who previously left poverty return to poverty within 5 years. So we think that there's something very important about these negative income shocks or volatility at the edge of scarcity that's creating enormous stress for parents and impacting their capacity to parent. And so when we think about parenting capacity, And we've started to use this metaphor of the capacity of a truck or an overloaded truck, similar to how families can become overloaded. If you put 4,000 pounds on a truck that has a payload of 3,000 pounds, it's not going to function as designed. So true of families. And what you see in the boxes are the same predictors that we saw on an earlier slide. So we think it's possible to remove some of this load and help families to function more optimally. But it's important that to understand that most of our framing, when we think about families and think about our interventions, we think about families at the individual level. Most of our interventions are designed to address some problem that the parent is having or some perceived pathology. And we rarely think about the system level or the macroeconomic context as a target of our intervention. This World Health Organization framework, I think, really helps us to do that. It looks at the social determinants of health, many of which are quite similar to risk factors for child welfare system involvement. And it found in creating this framework that the single most significant lesson of creating the framework was that interventions and policies to reduce health inequities must not limit themselves to the intermediary or the individual level, but must also include policies specifically crafted to tackle the underlying structural determinants. So from a theoretical model, I think this really helps us understand that we should be engaged not only with the family and helping them in the moment that we are in front of them, but also being engaged in the socioeconomic and political and macroeconomic context. This study shows us, actually, this is a recent analysis, it's forthcoming, it's not yet published, why these macroeconomic and other population level policies are important and deserve our attention. The roadmap for reducing child poverty looked at 4 different anti-poverty packages, and a recent analysis simulated the effects of increasing income in these via these 3 packages that are on the right, and found that they have the potential to reduce annual CPS investigations by 11 to 20%. And the reductions were particularly large for Black and Latinx children and those with single parents. So you see that these packages have the potential to reduce child welfare system involvement between 19 to 29% for Black children. We often hear concerns that families won't spend the money if we provide benefits in a particular way, in ways that are aligned with the intent of the policy. But we have a pretty robust evidence base suggesting that families or individuals spend unconditional cash payments to meet basic needs. Those factors that we have talked about earlier related to material hardship that are related to risk for involvement in child welfare, education, including tuition and childcare and paying down debt, and spend very little or reduce their spending on alcohol and tobacco. So we do think that given what we saw in the analysis of the roadmap for reducing poverty, that economic and concrete supports can differentially reduce disparity and disproportionality in child welfare. In part, we know that poverty and economic hardship puts families at increased risk of child welfare system involvement. And due to systemic inequities, families of color are more likely to experience economic hardship and volatility. And this may be contributing to their disproportionate child welfare involvement. And so we think that economic and concrete supports really could help to stabilize families of color in particular and prevent child welfare involvement and reduce racial disparities. Black and Hispanic families and other families of color in particular have far less wealth to buffer when there are income or employment shocks in their lives. The median net worth of a white family in the US is about $190,000 compared to about $24,000 for Black families. And the median net worth of a young Black family is about $600. We know also that CPS interventions are pervasive. So when I said earlier, that we're deploying one government intervention, this one happens to be particularly intrusive and has the ability to erode and interrupt family integrity. And it is deployed to over 50% of Black children by the time they turn 18, 30% of all children, and 41% of children in the 20 most populous US counties. So we think that there are policies that could be deployed in an effort to reduce the really intensive deployment of child protective services. And I'm going to have Yasmin talk us through that evidence.
Thanks, Claire. Let's start by talking briefly about the sources of evidence that are included in our presentation today. You can see on this slide the types of studies that we'll be talking about. There are only a handful of studies we cite that are randomized controlled trials. They're considered the gold standard of research because they can assess the causal impact of interventions. In those types of studies, participants are randomly assigned to either an experimental group that receives the intervention or to a control group that does not receive the intervention. There are limited randomized controlled trials in the child welfare space because ethical issues and other practical considerations often preclude experimental testing on this population. So most of the research we'll discuss today demonstrates associations and correlations, but not a causal impact. And this means that several other factors may also play a role in the results. The studies we'll share today shouldn't be considered in isolation. Rather, taken together, we think this vast body of science and growing preponderance of evidence expands our understanding of what has been effective and why, and informs potential policy shifts and new pathways. So what does the evidence suggest happens when economic and concrete supports are reduced? I want to start with just a little bit of level setting about what we consider to be economic and concrete supports. So this isn't an exhaustive list, but we consider economic and concrete supports broadly to include things like cash assistance, earned income tax credit, employment, income, SNAP benefits, housing supports, childcare, and Medicaid. Based on the research we've compiled, this slide provides an overview of the types of economic and concrete supports that, when decreased for families, are associated with increased risk for child welfare involvement. The studies include reduced TANF benefits, lack of child care and stable housing, and reduced employment and income. I won't be able to talk about all of these studies today, so I'm going to focus on a few key findings. Let's start with TANF. So this study examined the effect of TANF policy changes and benefit restrictions from 2004 to 2015 on child welfare involvement. And it found that states that imposed the sanction of loss of all benefits for not meeting TANF work requirements saw an increase in substantiated neglect reports, foster care entries due to neglect, and total foster care entries. As you consider this, it's important to keep in mind the first statutory goal of TANF, which we've included in that box on the right. And the goal is to support needy families so children can remain safely at home. States have considerable flexibility with their TANF policies, and one state policy option to consider is not taking away TANF benefits from the entire family if a parent does not meet the work requirements. This is known as full family sanctions. You can see in this map on the slide that nearly half of states took away TANF benefits from the entire family as an initial punishment if a parent did not meet work requirements as of 2021. And I also want to highlight that the states with higher concentrations of Black residents have a higher likelihood of imposing full family sanctions. There's quite a bit of research on the relationship between access to childcare and child welfare involvement. I'm going to share a few studies on this slide. In the top bullet, every childcare concern reported by families receiving TANF, they had a risk of supervisory neglect that increased by 20%. The study in the other bullet found that mothers entering substance use treatment who have difficulty securing childcare are 82% more likely to self-report child neglect compared to mothers entering treatment who don't have difficulty securing childcare. It's particularly interesting that difficulty finding childcare was a stronger predictor of maternal neglect than almost any other factor measured in this study, including mental health and severity of drug use. So let's now turn to what the evidence suggests happens when economic and concrete supports are increased. This is our summary slide of the types of economic and concrete supports that are associated with decreased child welfare involvement based on the research we've compiled. They fall into the following categories. We have macroeconomic supports, concrete supports, public benefits, child welfare interventions augmented with economic and concrete supports. I won't be able to talk about all of the studies in each of these categories today, but you can find them in the longer slide deck that's posted on our website, and that link was shared in the chat. All right, this recent important study found that the earned income tax credit and child tax credit payments are associated with immediate reductions in state-level child maltreatment reports. Specifically, it found that each additional $1,000 in per child EITC and CTC tax refunds is associated with a decline in state-level child maltreatment reports of 2.3% in the week of payment and 7.7% in the 4 weeks after payment. The authors hypothesized that the larger decline in the 4 weeks after payment may be related to the length of time it takes for families to resolve debts or other financial burdens after they receive those credit refunds. There's a growing body of evidence showing that the EITC is associated with a decreased risk for child welfare involvement. And in particular, it's the refundable state level EITC. That means that families can receive the credit even if they don't owe any taxes. Therefore, a state policy option to consider is establishing a refundable state EITC, which 26 states, DC, Guam, and Puerto Rico have done. Another state policy option to consider is establishing a state child tax credit. As of 2022, earlier this year, only 9 states have enacted a state level refundable CTC, but we see a lot of movement and hoping that this number will increase over the next few years. This study looked at the population rate of hospital admissions due to abusive head trauma in California before and after its 2004 paid family leave policy went into effect. And it compared those to 7 states with no paid family leave policy. And it found that California's policy was associated with a decrease in hospital admissions for abusive head trauma among both children under 1-year-old and among children under 2 years old. And this follows what Clare had shared before, that we have to think about economic and concrete supports, not only in relationship to neglect, but also to physical abuse. Only 11 states and DC have adopted a statewide paid family leave program. As a result, less than 1 in 4 workers in the US have access to paid family leave. This recent study looked at states that newly expanded Medicaid in 2014 and found that these states were associated with reductions in the average rate of child neglect reports across all age categories, compared to states that did not expand Medicaid. Researchers suggest that the increased household financial stability and improved adult mental health, both of which have been associated with Medicaid expansion, may contribute to a reduction in child welfare involvement. A state policy option to consider in the Medicaid space are Medicaid waivers that shift to a social determinants of health approach. These waivers provide an important opportunity to use Medicaid funding for non-medical supports related to housing, food, and transportation. This slide highlights the approved Medicaid waivers for North Carolina, California, and Oregon, but I want to note that several other states have also had similar waivers approved. Shifting to childcare, states with more flexible child care development fund program policies regarding subsidies for child welfare supervised children have, on average, fewer child removals than other states. And what do we mean by flexible program policies? Well, this study looked at flexibility around eligibility, priority lists, family co-pays, and the activity requirements to qualify for those subsidies. For mothers who are low income, each additional month they receive a child care subsidy is associated with a 16% decrease in the odds of a child neglect report in the following 12 months. So New Mexico has really prioritized increasing access to childcare for its families. It's invested in making childcare free for most families over the next year, with a goal of developing a free universal childcare system. And they just got one step closer this week when New Mexico overwhelmingly approved a ballot measure, making it the first state in the nation to guarantee a constitutional right to early childhood education. And as a result of that, it will create a dedicated funding stream for universal preschool and childcare, as well as expanded home visiting programs. This randomized controlled trial by our colleagues at Chapin Hall assessed the impact of a supportive housing intervention for child and welfare involved families who faced housing instability. It found that compared to the business as usual control group, families who received a housing voucher and case management services experienced fewer removals, a lower prevalence of substantiated maltreatment, and increased reunification. Housing instability is a critical issue for many families that become involved in the child welfare system. To address this, Wisconsin is launching a pilot program that will provide short-term housing funds to families at risk of removal due to housing insecurity and to families unable to reunify due to inadequate housing. Let's turn to SNAP and WIC. This longitudinal study tracked children's WIC and SNAP participation, as well as substantiated child maltreatment reports. It found that children from low-income families who participated in SNAP or WIC had a lower risk of experiencing substantiated child maltreatment reports compared to children from low-income families who didn't participate in either program. This recent study reviewed state policy options that expanded eligibility and access to SNAP and found that states with more generous SNAP policies experienced large reductions in CPS reports, fewer substantiated reports, particularly for neglect, and fewer foster care placements compared to states with less generous SNAP policies. Let's now turn briefly to family preservation programs. This study found that families with open child welfare cases who received a home-based services program that provided concrete supports are less likely to experience a child maltreatment report compared to families who received the program but without any concrete supports. Several states provide concrete supports to families through family preservation programs in an effort to prevent foster care entry. Kentucky's recent state budget included up to $1,000 in flexible funds for families participating in their family preservation program to meet their concrete needs and prevent removal. And with that, I'm going to pass it back to Claire.
Terrific. Thanks so much. I have just a few slides and then we're going to take a look at the questions in the chat. But, we've been thinking about individual programs, and I'm going to kind of zoom out just a little bitty bit and talk about more macroeconomic or population level prevention strategies that are important given this context. This analysis shows us that county spending on prevention services is associated with individual maltreatment reports. So mothers that were receiving WIC benefits in counties with greater amounts of per child spending on prevention services had lower odds of an individual child maltreatment investigation. And this was irrespective of whether or not they actually received the prevention service. This is a universal home visiting program. I actually think of it more as a community response or community connections program. 1 to 3 home visits from a nurse with a focus on material needs at the universal level in this randomized controlled trial in 2 counties of all families in 2 county hospitals in Durham, North Carolina. They found that families that were assigned to Family Connects, which again was about connecting families to resources primarily, experienced 39% fewer CPS investigations through age 5. The findings here suggest that when implemented with high quality, a brief postpartum nurse home visiting program that focuses on connecting families to resources can reduce population rates of child maltreatment. This analysis looked at state spending. So we looked at county spending a second ago. We're going to look at state spending. Polls et al. Found that for each additional $1,000 that states spend annually on public benefits per person living in poverty is associated with a 4.3% reduction in child maltreatment reports, 4% reduction in substantiated child maltreatment, 2% reduction in foster care placements, and a little less than 8% reduction in child fatalities due to child maltreatment, independent of federal spending. This analysis also showed that while spending the additional $1,000 per person in poverty is quite an investment, that there was a return on investment over the long term. So when you think about what's the state policy option, it's state spending. We see here from their analysis that state spending per person in poverty on public benefit programs is highly variable, as well as the mix of the benefits that states choose to fund. So we'll spend just a half a second thinking about resources and how we might think about shifting them or saving resources. The annual costs of maltreatment in the US are quite expensive. These are 2 different analyses showing that the direct and indirect costs of child maltreatment, 80 billion in one analysis, 428 billion economic burden due to substantiated child maltreatment, and 2 trillion economic burden due to investigated child maltreatment. And these are lifetime costs incurred annually. But there are also human longevity costs for not addressing family needs and preventing child maltreatment. Compared to children who do not experience early life adversity, children who experience family instability, inclusive of foster care, this is associated with about a 28% higher risk for premature death. And children who experience poverty and crowded housing is associated with about a 41% higher risk for premature death. So there are long-term consequences and costs associated with child maltreatment and foster care that perhaps we might think about how to reorient our systems and policies so that we are really very much in a prevention space. And this visual tries to help us do that. We often see families or children at the center. This graphic tries to center the policies. Our macroeconomic policies can help to prevent families becoming overburdened and can alleviate when they have become overburdened. For families for whom those macroeconomic policies are not sufficient, additional concrete supports like childcare and healthcare, human benefit support services like TANF, all can begin to alleviate the load that families experience, placing them at higher risk for involvement with child welfare. And we have here this economic differential response and community pathway that could sit above child welfare and allow all of our collective services to prioritize family needs when we see them with increased risk factors or struggling to maintain a household in which their children can be safe and thrive. So that child protection and foster care is used truly only for those instances in which child safety is imminently at risk and children are at very high risk of harm. So we very much appreciate the ability to talk with you today. And as I was going through this data today, thinking about it from a protective factors framework, I guess one of the things that sort of popped out to me is that we often think about providing concrete supports when families are in need or at their time of need. And this data, I think, suggests that thinking about macroeconomic policies before families are in deep need is a key strategy for averting child welfare involvement. So sometimes things just hit you differently given the context, and that certainly did today. So I'm going to open up the chat box and see if there's anything here. And I'm actually going to also kind of encourage folks to come off mute and just reflect on the data and the information, or any insights or thoughts that you have, or any pushback, or ways that we got it wrong.
We do have one question entered in here. Thank you, Clare and Yasmin, so much. We have one question to start us off from Ann Stone asking, is there any data that teases out the impact of positive fatherhood involvement on CPS outcomes?
I am certain there is, and I don't have it readily available.
Yeah, I think we could say, as we connect it to the concrete support, we certainly know that the more you have two parents involved, the more economic input there is to the family. So that would be an indirect line, but I'm sure there's
absolutely. There's a large body of science around fatherhood involvement and reduction in child welfare system involvement. It is just not the focus of our primary research here. But absolutely, Kaylin, you're exactly right. The additional resources in the family from a two-parent or two-partner income absolutely can help. There's also some really interesting data around unemployment, particularly male unemployment, and elevated risk for child welfare system involvement that we do have in our other deck. So yes, absolutely, there's data. I cannot give it to you off the top of my head.
Totally fair. We've got a couple more questions that have come in here. Edward Cohen asks, what are your thoughts about how concrete supports work as a protective factor, i.e. reducing stress related to unmet needs? So I think just your continued thinking about how that functions.
Yes, in our broader slide deck, we have a couple of theoretical models that I think answer that question well. The first is the family stress model that starts out with economic hardship and the additional cognitive load and psychological stress that economic hardship can place on individuals and families. And it then therefore creating additional risk for less nurturing and harsh interactions in families and increased risk for child welfare system involvement. So there's a theoretical model that frames it in that direction. There's also a theoretical model around the family investment model that kind of flips that on its head. whereby families have additional sufficient resources to meet their basic needs. They are not cognitively overloaded. They have the ability to turn their attention, their focus, their effort onto their children and to provide in the household. So I think that there are a couple of minimally theoretical models that help us to understand that. And again, I would turn you back to the WHO social determinants of health model that help us understand beyond the individual. I think if anything, my lesson, like the WHO, of compiling and understanding this research over the last 3 or 4 years, is that our conceptual frame in the US and kind of across the board, beginning in the Elizabethan poor laws in the 1500s, at least, have us framing the individual stress that a person has, whether or not individuals are deserving or not deserving of our help and our resources, whether or not our interventions are oriented towards the individual. And that it very much helps, I think, to zoom out even just a little bit and think about context and the context in which families live and our ability to address that in a really different sort of way.
Just one very quick addition to what.
Oh, thank you very
Clare,
much, Dr. Willis. I see you in the chat box.
In addition to the theoretical models, there's actually a lot of evidence we have now from the unconditional cash transfer payments and the guaranteed income pilots that's in our larger deck that show that those who received those payments had a significant reduction in depression and anxiety. And we have a lot of research now from the COVID stimulus payments and enhanced federal benefits in terms of the cash payments, improved unemployment benefits, the enhanced CTC, that show like a reduction in stress for families. So I think there's quite a clear link there as well in the evidence.
Yes, thank you, Yasmin. We have a question from CSSP Zone, Judy Meltzer, asking about how many of these studies looked at differential impacts by race, ethnicity, and immigrant status.
Well, I'm so glad you asked that question. That's a really great question, Judy Meltzer. We've actually just recently gone back and looked at the first tranche of studies that we, hold on just a second. I'm trying to do two things at once and I'm not able to do that. I'm so sorry. So we looked at the first tranche of studies that we reviewed and found that over 50% of those studies had a target population or a group of people that were receiving the service, over 40% Black population. So we are beginning to think, not surprisingly, that that economic and concrete supports might be in and of themselves a differential intervention or support for families of color. And I'm sorry, I didn't say that very well because I'm trying to also get the slide up that Kaylin has asked me to do. But yes, I'm beginning to think that, well, we certainly know that employment volatility is different for Black families. It's almost double employment volatility for white families, and that certainly translates into income volatility. And we're beginning to understand much better that these negative earning shocks or volatility in the income in the family is a likely driver of risk for child welfare system involvement. And so it's not surprising that you might see economic and concrete supports having a differential risk, effect for Black families and brown families in particular. Okay, so now I'm going to share my screen and talk a little bit about, just make sure that folks, oh, I don't know why it's doing that. Oh, I know why.
I think you accidentally said play from start instead of
that's exactly what I'm doing.
Yeah.
Play from current slide is what I want. Sorry for the technical difficulties, my colleagues. I didn't practice this part.
I've been having my own technical difficulties, so I'm very grateful for the support of all the team jumping in to share stuff.
There we go. Okay. Play from current slide. Yes, I can do two things at once. Caitlin, you want to talk a little bit about this brief?
Yeah, just wanted to make sure folks know that on CSSP's website, there is a 2-pager that summarizes a lot of this research about the title. You can see there, Investing in Families Prevents Child Welfare Involvement. So that is on our website. And then on the next slide, you can see a recent article, very current article in the journal Child Welfare, co-authored by Alex Citrin and Megan Martin at Center for the Study of Social Policy and Clare at Chapin Hall. So an article summarizing a lot of this research and investing in families as an anti-racist approach to supporting families. So want to make sure that folks are aware of that and all the collaboration on this topic between our two organizations, which we're really excited to be able to help move this content forward. So thank you so much, Claire and Yasmin. I know that Yasmin responded to a couple of questions in the chat. I think we answered all the questions that were raised, and we're going to take a few minutes here to share updates from the Children's Trust Fund Alliance and from CSSP. And so if there are more questions folks have, you can keep on typing them in the chat while we share these updates, and then we will share these updates. Thank you. I'll hand off to Maureen. Oh boy, you're gonna have to go through a bunch of slides. So all of you are gonna get this slide deck, which has a ton of references in it. I believe 20 slides worth, so you can really dig in. Okay, go ahead, Maureen.
Thanks, everyone. Maureen Holliker from the Children's Trust Fund Alliance. The only update I have for you today is that our training of trainers in January is registration is open. It is filling up pretty fast. I think we're about halfway full already. So if you're thinking about becoming a trainer in the Protective Factors Framework, please go ahead and sign up soon. And I will put the link in the chat. Have a great weekend, everyone.
Thanks, Maureen. I'll just share a few more updates from CSSP. We can go right to the next slide. We have a new messaging guide about early relational health. So many of you were probably on the webinar we did earlier this year about early relational health and have seen us putting out videos and other pieces throughout the year. And we were working hard behind the scenes on this messaging guide that we are very excited to share. It has a definition of early relational health that has a lot of consensus around it from parents and leaders and experts from all different perspectives. It has a core story about why attention to early relational health matters and how we can affect change. And it has key messages for specific stakeholders. So if you're curious about early relational health or you are already interested in it, please go to that messaging guide and dig in. And I was going to put the links in the chat, but I'm having technical difficulties. So those will be in the slides that you can access, or you can go on our website and search early relational health messaging guide and it will come up. So let's go to the next update. Just to make sure everyone's aware, the Brackeen versus Holland case that the Supreme Court heard yesterday and is, deliberating on is a very solid challenge to the Indian Child Welfare Act. We have a blog on our website about why this is such a threat, and hope that you can take a moment to read that if you're not that familiar with ICWA or if you're not sure, what the different arguments are. CSSP's position and the position of many advocates is that ICWA provides vital protection for American Indian and Alaska Native children. It really is a strategy to correct for the terrible and intentional harm that was done in earlier years. And ICWA really should not only be held up, but it should be a model of how we can prioritize keeping children and their families communities from other populations as well. So check out our blog post on that. And we'll all stay tuned for that decision. Going to the next slide, CSSP is hiring for a few key positions, including president. Judith Meltzer is retiring, and we are looking for the right person to carry on that legacy of leading CSSP. We're also hiring for a program analyst position and a communications coordinator. You can find all of those job listings on our website. And I see the note, yes, no one can replace Judy Meltzer. We love Judy and we're grateful for her leadership, but she is ready for the next person to come and step in and take CSSP into its next phase. So hoping that we'll get lots of great applicants. We'd love to get applicants who are already connected to our Strengthening Families Network. So feel free to share that. Let's go to the next slide. A new brief that just came out about community health workers as catalysts for change. And this is under the heading of anti-racist approaches in healthcare. So really looking at the work that community health workers, promotoras, and others do, serving their communities and making a much stronger connection to healthcare than some of those communities have had in the past. So I encourage you to check that out. There was also a webinar last week that I'm sure you can find the recording if you want to dig in on that content. And that is all the updates we were going to share. So thank you all very much for joining us today. Thanks very much to Claire and Yasmin for presenting and for all of this great work. Thank you, Maureen, for picking up the slack when my technology was not helping me out today. And thanks everyone for joining us. We always appreciate being able to dig in on these conversations, and it sounds like people got a lot out of it. So really, really grateful that you were all here, and we'll see you again next month. Thank you.
Thank you.